Imagine if your favorite holistic health blogger suddenly got tapped to be the nation's doctor. That's basically what just happened when President Trump nominated Casey Means, wellness guru and sister of a Kennedy health advisor, to be the next U.S. Surgeon General. Move over, Dr. Oz. There's a new celebrity doc in town, and she's got the White House's stamp of approval. Mintz isn't your typical government appointee. She left a surgical residency to co-found Levels, a health tech startup that helps people track their metabolic health like a Fitbit for blood sugar. She's also the author of Good Energy, a book that reads like a love letter to kale and intermittent fasting. Now, she's poised to become the face of American public health. Assuming Congress doesn't grill her too hard over whether avocado toast counts as preventive care, the nomination came abruptly after Trump yanked his first pick, Janette Nesheiwat, a Fox News medical contributor who suddenly found herself in hot water over questions about her medical degree and past support for COVID vaccines. Means, by contrast, has spent years criticizing Big Pharma and the sick care system, arguing that profit-driven medicine keeps people unwell. If confirmed, she oversees 6,000 public health officers and could push a radical shift toward prevention over pills. But here's the twist. Means hasn't actively practiced medicine in years. She placed her medical license on inactive status in 2024, trading stethoscopes for startup funding and Instagram-worthy wellness tips. Critics might ask, can someone who left clinical medicine really lead it? Then again, in an era where influencers outnumber doctors on some people's feeds, maybe it's a genius play. The bigger question is how her agenda rooted in metabolic health and anti-establishment rhetoric will translate to policy. Will she push for insurance-covered glucose monitors, declare ultra-processed foods a national emergency, or just tell us all to take more forest baths? One thing's certain. If she starts prescribing Twitter detoxes as official health guidance, big tech might lobby harder than Big Pharma. For regular folks, this could mean a surgeon general who is more likely to tweet about circadian rhythms than cigarette warnings. It might also mean a louder spotlight on lifestyle medicine good news. If you've ever wanted your doctor to blame your Cheetos habit instead of your genes, but skeptics worry her approach, downplay vaccines or evidence-based care in favor of biohacking trends that haven't exactly been peer. Then there's the political circus. Means is tight with Health Secretary RFK Jr., whose own vaccine skepticism has raised eyebrows. Trump praised her impeccable MAHA credentials. That's Make America Healthy Again. For the uninitiated, but will that slogan hold up when the next pandemic hits? It's one thing to rail against processed food lobbyists. It's another to convince Congress that kale subsidies are a national security priority. The nomination also highlights a weird contradiction in modern healthcare. We distrust the medical industrial complex, but still want our surgeons general to have Ivy League pedigrees. We mock wellness fads, but elect leaders who promise to fix chronic disease with better wellness fads. Mean sweater Stanford MD and influencer clout somehow bridges both worlds. Whether that makes her a visionary or just a very savvy operator remains to be seen. So what's next? If confirmed, Means could become the most unconventional surgeon general in decades or the shortest, depending on how Washington reacts to a Texavi doc who thinks metabolic health is the root of all evil. Either way, her rise signals a growing rebellion against traditional healthcare. And if nothing else, it'll make for great TV. Now, over to you. Are you Team Wellness Warrior or Team Where's My Actual Doctor? Drop a comment, share this with your group chat. Embrace yourselves for the inevitable surge in celery juice memes. P.S. If you're watching this while stress-eating Doritos, don't worry, Means isn't in charge yet, but maybe switch to just in case.